The next presentation will be given by Dr. Tak. Dr. Tak is currently the Director of Operations at Medipeace. He also has a background in public health surveillance with the U.S. Centers for Disease Control, and most recently he was a Chief Epidemiologist for the Joint Program Executive Office for Chemical and Biological Defense and Biosurveillance Portal. He's also my direct supervisor and my boss. Please welcome Dr. Tak.
Thank you for your kind introduction. You didn't have to say that. I'd like to keep this as a more interactive session, so if you have any questions or doubts, please jump in, and please, David, you can jump in as well, because this is probably the same stuff, but I'd like to spend a few more minutes on the detail and examples that we have. So, like David Wang mentioned, the GHSA is hot, and it's led by U.S. And being participated by a lot of nations and countries across the world. One thing that I'd like to mention or emphasize is that it's global health security agenda, and it's not global health and security agenda. It's global health security. So we're talking about security of global health, and we have agenda for that. So this is very confusing because health and security, we have two terms in the same name. It confuses a lot of people, especially in the military and law enforcement sector. And people think about health and security as an equivalent topic, but I should say they're not. We talk about security because this health issue affects human health. So we want to be secure from the health issues. That's why we're saying health security agenda. So I'd like you to go home with this lesson that GHSA is not health and security issue. It's health security. Is that clear? Thank you. You may not agree with that. So GHSA, I'm going to talk about a little bit of history later, but this is actually an effort to make progress toward full implementation of the IHR, International Health Regulation. As it's saying, it's international health regulations. Regulations are laws. It's a principle. You're supposed to comply with it, and you're obligated to follow what's dictated. So it's regulation that's that global communities are supposed to comply with. But it turns out that not a lot of countries or nations are complying with it. And also the Animal Health Agency, World Organization for Animal Health, or stands for OIE, they have something equivalent to IHR. It's called Performance of Veterinary Services Pathway, PVS. It's the same thing, but OIE has this PBS system is very successful. So a lot of countries, they're willing to share their information about the animal disease and infectious disease about animal health. But for the human health, the human infectious disease, they're not very willing. So it's creating a lot of issues. So the first effort is, I should say, IHR is the first step. But before IHR, there was an initiative that's calling for global health security issues. It's called Global Health Security Initiative. It was initiated by G7 countries, plus some of the European Union countries and Mexico. They're mainly trying to develop a better framework for official development assistance, ODA, for HIV and AIDS. So they gathered around and created this GHS initiative. It was 2001. So that effort was slowly gaining its momentum until 2009. They started calling for more active roles for certain countries. So they named it as Global Health Security Agenda. It was 2009. And basically they wanted to reorganize some of the ODA effort for infectious disease. this infectious disease is a main topic for global health security agenda. It's because infectious disease is probably the heaviest burden-causing issue. If you look at some of the statistics in the developing countries, we have a lot of health issues, but I should say about 60% of disease burden is caused by infectious disease. So still, we have a lot of non-infectious disease issues in the world, but infectious disease is probably the most important health issues we need to tackle. Dr. Wang talked about some of the action packages, but here is the action package that Republic of Korea is taking the lead on. It's one of the last, I think it's the last action package of 11 action packages on the GHSA. So Korea is supposed to lead this effort with other participating countries. So linking public health with law and multi-sectoral rapid response action package. So we have this term, public health with law, meaning law enforcement, so police department, and public health working together. I want you to imagine that. And also multi-sectoral rapid response. We're talking about rapid response, and we had this experience last year, or was it 2 years ago? 1 year ago, yes. MERS coronavirus outbreak. And we suffered the lack of multi-sectoral approach in terms of responding to outbreak. And Korea is leading that effort. Was actually at that time. And working with the police department to deal with the public health issues, infectious disease outbreak. It's not easy. And in my former life, I actually spent a lot of time trying to get police department working with CDC. And we had a couple experts who were capable of teaching some law enforcement and working with epidemiologists in the field. And we brought those experts to Korea, and we wanted some of the police department people take that course and learn about how we can work with law enforcement when we deal with the infectious disease outbreak. They were very interested, but they were too busy to attend. So we didn't have anyone from police department, but some of the KCDC people attended. So we're getting a little bit of attention on this action, but it still has a lot of work to do in the long run. 5-year target is to be shown as the Korea government being able to conduct a rapid multi-sectoral response, and this is being embodied in other ministry. It's not police department, it's Ministry of Public Safety and Security. It's called 국민안전처 in Korea. So they have this police, a fire department and dispatchers across the country. They are willing to work with KCDC, and they have been developing some of the framework in which they can collaboratively work with KCDC, especially when there's an outbreak. And I've been fortunate to work with MPPS developing their own target and indicators. So the desired impact that's designed for this action package is the development and implementation of a memorandum of understanding among organizations, meaning MOUs between CDC and MPPS, or MOU between MOH with Ministry of Defense, etc. It turns out that we already have those MOUs. It's just that they don't work together. Yes?
I just want to mention something with this topic. I've been working a little bit with Korea on this as well, and there's a course that the US CDC and the US FBI, Federal Bureau of Investigation, they host. It's called CRIM-EPI, CRIM-EPI, it's short for Criminal Epidemiological Workshop. And this training is hosted in the US, various cities, many times a year. And there was one last month in Seattle. And we had 2 folks from KCDC come to that training, again, because of this action package. And we tried to get someone originally from NIS, National Intelligence Service in Korea, was going to go as well to represent the criminal side. but that didn't work out at the last minute. But we're thinking about trying to bring the trainers of that course to Korea at some point, where we could host one of these CRIM-EPI trainings here. And so that's kind of low-grade discussion because we don't have any funding to do that right now. But I think enough people in Korea have expressed interest, but it's very difficult for everyone to go to America to take this course. So I just want you to be aware of that, and that's something that might see on the horizon.
So CRIM-EPI, it's criminal epidemiology,
Yes.
or criminological epidemiology training.
Yeah, people just call it CRIM-EPI.
We're talking about criminology and, no, criminal epi because some of the infectious disease outbreak can be planned and planted by a terrorist group. So it was intentional infectious disease outbreak. So to be able to respond to that, you need a certain capability in terms of law enforcement, I should say. So, thank you for that comment. Let's talk about the relationship between Global Health Security Agenda and KOICA. As Dr. Wang mentioned, that President Park declared that Korea is willing to donate $100 million to highlight some of the support for Global Health Security Agenda, and it's committing that money to assist 13 countries building capacity to prevent and detect and respond to infectious disease. Major activities like David Wang talked about include immunization and enhanced national laboratories and health workforce development. I'm going to spend a few more minutes to talk about what are these. Immunization. Basically, immunization requires a lot of work. It requires basic infrastructure as well as the delivery system. And you need to be able to understand how much vaccination immunization is needed for the country. And you need to plan ahead for a certain surge event. And to be able to respond to that kind of need, you have to have a plan. And as a core activity for this immunization action package, it requires, or it emphasizes the surveillance effort. So surveillance is data collection and analysis effort, but based on that surveillance, you can actually measure how much resource you're going to need and how much demand is being addressed for the country. And it's actually, it has, okay. Case-based surveillance for vaccine preventable diseases. So we need to have a surveillance for vaccine preventable diseases. Does KCDC have that? Yes. But is it integrated with other public health surveillance system? No. It's still working to be able to develop that relationship. Why do we need case-based surveillance for vaccine preventable diseases? It's because we want to know what kind of vaccine preventable diseases are actually on the rise, if we have any. Also, we want to see, sometimes this vaccine preventable disease are caused by the vaccination itself. Because there could be a problem in manufacturing the vaccine, and the vaccine happens to have some live pathogens in it. And in that case, we get to see them. And we want to know if that's caused by the vaccination or the naturally occurring disease. So the case-based surveillance for vaccine preventable disease is very important in this. Also, we need to be able to detect and respond and investigate a certain vaccine preventable diseases outbreak. And I think Korea is doing a good job at detecting and investigating vaccine preventable outbreaks in the country. And also it has a very good lab access across the country, not just at the central level, but also local level. It can detect a lot of vaccine preventable diseases. And safe injection practices. We're talking about safe injection practices because injection is injection. It should be simple, but it's not. As you know, the what's called, I forgot the name of the TB vaccination.
The BCG?
Yes, BCG. It requires certain skills to vaccinate the patient. And if you know how smallpox vaccination is being administered, it requires a lot of stuff, and it needs some training for physicians and nurses who can administer vaccination. So injection practice should be practiced beforehand. And also, vaccination of healthcare workers is also important. You're dealing with vaccine-preventable diseases, but if some of the health workers are not immune to that vaccine-preventable diseases, the healthcare workers becomes pathogenic, and they can spread the disease in a maximum capacity because they see patients. Let's talk about lab strengthening. We're talking about national lab strengthening, and Korea has a very good lab infrastructure at the national level and local level. And the lab is needed because to be able to respond to infectious disease outbreak, it not only requires surveillance effort, but also you need to be able to identify the pathogens in a timely manner. If you don't know what kind of pathogens you're dealing with, you don't know how to respond. So to identify the pathogens, you need pretty good labs. We're talking about infectious disease pathogens, and dealing with infectious pathogen, it requires certain biosecurity level. And biosecurity level 3 and 4 is probably the most desired level. Korea didn't have BSL 4 lab recently, but they just opened it up. So KCDC now has BSL 4 lab. BSL 4 is probably the highest level of biosafety level. So Korea has advanced in terms of biosafety, biosecurity facility. And it also has a pretty good network linking with local labs, with the national lab. And this is aligned with the US CDC's effort calling for, what was the name of it? I forgot. LRN, yes, Laboratory Response Network. I'm glad you're here. My memory is getting rusty and rusty. So LRN is Laboratory Response Network, meaning that laboratories are connected to be able to respond quickly. So that's why it has Laboratory Response Network. It's basically US-based network, but in the past, US has been leading to expand that network toward the global community. So it's connecting countries as well, and Korea started participating in that network a few years ago. So KCDC and another hospital, I think, Seoul National University Hospital, or 2 or 3 national labs are participating in that response network. And it's basically cutting down the time lag or time difference between the identification and the response. Because the faster you can identify the pathogens, the quicker you can respond to that outbreak. So delivering that sample of a specimen to the lab and be able to identify the pathogen and report back to the responders about the pathogen, it requires a lot of time. So cutting that time is crucial in terms of responding to outbreak. And Korea is helping other countries as well to set up their BSL lab constructions. And I'm glad that Korea is taking the lead on this as well, spending that GHSA money for other countries. Workforce development. As you all remember, during that MERS coronavirus outbreak last year, they talked about lack of public health workforce, and we didn't have a lot of experts dealing with the infectious disease outbreak. And we talked about epidemiologists and physicians and veterinarians and nurses. They're good at treating and curing or taking care of patients when they become patients. But before they get sick, they also need to be handled or protected. So epidemiologists or some of the physicians who can work to prevent or minimize the impact of infectious disease outbreak. We not only need the physician who can take care of the patients, but also who can start thinking about how to prevent, how to stop spreading the disease in the community. So we need a lot of epidemiologists and physicians who are mainly probably preventive medicine or nurses, local community outreach experts and trainers, etc. So that kind of workforce is needed, and Korea is still working to advance in terms of getting that workforce ready for a certain future outbreak. I want to spend a few more minutes about joint external evaluation, like Dr. Wang mentioned. So joint external evaluation is done for only a few countries. And this is a good tool because it gives you an idea about what's needed for the country and where we can reallocate some of the public health resources to certain areas that country might take full advantage of. And also we can prioritize some of the reallocation of the public health resource by looking at JEE. And a joint external evaluation is done actually more than 6 countries, but now the result is available for 6 countries, and one of the countries happens to be Tanzania, and I want to show you some of the JEE result for the Tanzania. I'm showing you Tanzania because it's available, but also we have a field office in Tanzania, and I just got back from Tanzania, and I have very vivid memories and observations about where they are. So the first thing, national legislation and policy financing, and if you look at the color, it's 2 or 3, meaning it still needs work to do. And if you see green, like at the bottom, 4 or 5 is telling you that certain policy is in place and being implemented, but it's not sustainable enough. So if you have a point score 5, it means it's now sustainably working. So 4 and 5 is pretty good, but 3, 2, 1 is meaning that they still have a lot of work to do. So let's look at the red. Antimicrobial resistant detection. They're talking about detection. So AMR is taking place in many places in Tanzania, but they're not able to detect, meaning they don't have surveillance system. So surveillance system is not in place. And healthcare associated infection prevention and control programs, they do have programs, but they're not in place in many different places. One thing that I'd like to talk about on this table is that it tells you about the average for the nation. So Tanzania is a big country, and it has some of the capabilities and capacities for the country, but that capacity is not readily available at the local level. And the local level, there's a huge variation in terms of getting the access. For example, immunization. Vaccine coverage for measles is pretty good. They have national program, but it's not available for local levels. Some of the cities and states, they don't have resource, and they don't have workforce to be able to distribute and deal with it. And national delivery system is in place. It's not sustainable enough, but for some communities at the local level, they don't even know what that is. Some of the patients actually, they should go out to the market and buy their own immunization and bring them back to the hospital so they can be administered by the nurse and physicians. So the policy is in place, but it's not sustainable enough, and it's not available for some of the local communities. Next, they're talking about surveillance and immunization national lab system. Let's look at the national lab system. So lab testing is being done, and specimen referral and transfer system, delivery system is in place, but it's not really working well. And lab quality system, quality assurance and quality control system is still working in progress. And reporting. Surveillance system and real-time surveillance, they're talking about indicators and interoperable system that enables real-time reporting, and also analysis of surveillance data and syndromic surveillance system. They're all in place, but I've never seen it. And in fact, the surveillance system requires a lot of IT infrastructure and resources, and Tanzania is still lacking in some of the IT capability. And a lot of hospitals at the local level, they don't even have computer access. But it varies, actually. Some public health clinics have their own intranet system, whereas some of the large hospitals, they don't even have computer access. So this variation is still an issue. Am I losing the audience here? I'm boring you, right? One more thing. So, emergency response operations. Emergency operation program is not in place. But if you look at the top, Emergency Operations Center operating procedure and plans. So they do have emergency operation SOPs in place, but they don't have enough facility and enough resource. And they don't have emergency operation program. We're talking about emergency operation program in the context of infectious disease. So when there's an infectious disease outbreak, it becomes public health emergency. And to respond to that public health emergency, you need to have a program that facilitates operations responding to that emergency. And Tanzania is lacking that capacity. JEE for Republic of Korea is not done yet. It's in the process, and like Dr. Wang mentioned, it's planned for December 2017. I know some of the experts from US and other countries will come and implement that JEE with other government agency partners. But I did it on my own, just out of curiosity, and I want to share some of my evaluation about Korea's capability. National legislation is really good, and they have been complying with the IHR in the past several years, and they're pretty good. And IHR coordination, communication, I should say it's pretty good. And antimicrobial resistance, they have everything that's needed. And in fact, Korea is one of the leading countries in Asian region that's leading the effort to prevent and minimize the impact from AMR issues. And zoonotic disease, Korea government has a pretty good information system to coordinate all the efforts dealing with animal outbreaks. And Korea is one of the first countries that started reporting a lot of animal-related disease, foot-mouse disease, and etc., and AI stuff. And they work with other agencies to be able to coordinate some of the efforts in responding to animal disease outbreaks. Food safety. It's actually, we have, what do you call that, Korean FDA that's dealing with the food safety. So they have epidemiological investigation capability. They send people to investigate some of the food poisoning outbreaks. Also, KCDC has some issues or capabilities to deal with food safety issues. But the problem is, the mechanism is still work in progress, because when it comes to food poisoning, KCDC and Korean FDA don't work together. And as you remember, global health security agenda requires multi-sectoral and collaboration between agencies. And KCDC and FDA, KFDA don't work together. So that's probably the reason why I scored 3. Biosafety and biosecurity, like I told you, KCDC has a really nice facility for BSL-4 lab, but other agencies have access to that facility? No. KCDC only has, I only have 5 minutes? Thank you. I can go 1 day. All right. So immunization is pretty good. We have national coverage for immunization. Most of the vaccine preventable diseases has over 95% coverage so far. So Korea is probably one of the advanced countries in terms of immunization. Emergency response operations. KCDC recently built its own EOC centers, Emergency Operations Center. It's really nice, and I happen to be one of the advisors for building that EOC center. And they built this to respond to the country's need for when it comes to infectious disease outbreak. They need a coordination center, and EOC is where all the coordination is taking place. And KCDC didn't have that capacity during that last MERS coronavirus outbreak, and now they have. And I think we should see how it's going to function in the future outbreaks. Medical countermeasures and personal deployment. This is very interesting. We're talking about medical countermeasures, talking about rapid immunization during acute outbreak and infectious disease. It's because we have different level of threats, meaning North Korea is actually posing a lot of potential threat. North Korea is ready to use its own infectious disease pathogens and causing some of the social disturbance during wartime or even peacetime. And getting the medical countermeasures for that kind of incident is not fully equipped for the Korean government. So it's still work in progress. That's my evaluation. Again, this is not official, it's my own evaluation. What can we do? I wanted to talk about what private and public sector players can do working with government agencies, offering what we can. Like I told you, Korea has pretty good capacities when it comes to Emergency Operations Center and National Lab and public health surveillance with the given the information technology capabilities. And also, field epidemiology training program has its own curriculum. It's way better than any other country's curriculum, but it's not just being implemented in an effective way. When we do a lot of diplomacy by providing economic assistance, but I think it's time for us to do more of health diplomacy, providing assistance for developing countries dealing with their health issues. And the health issues could deal with a lot of issues, but only not only infectious disease, but also non-communicable disease as well. And I think it's time for us to reshift the ODA effort to enhance public health capacity, whereas it has been focused on more of economic development in the past. And I think Korea has a lot to offer when it comes to surveillance, and because it's IT capacity, but also it's equipped to respond to the outbreaks rapidly. Still, we have a lot of work to do in terms of multi-sectoral and whole-of-society approach, but this approach should be embedded in ODA effort in the future. Meaning, ODA is an effort, but once it's realized at the local level, at the national level, or the community level, it requires a lot of players. And think about when you implement a project at the local level, you need a lot of people from government and local hospitals and stakeholders and communities. But this is a purely multi-sectoral and whole of society, and this approach should be spelled out clearly on the ODA paradigm. So I'll finish my talk with that. Thank you. Sorry, I took up a lot of time, so.
It's okay, we can still have some questions.
Okay.
I think Thank you for your informative presentation. I'm Hyun Ho-young, a project manager of Medipeace. We are talking about global health security agenda, right? But this GHSA is kind of a promise among countries, I think. So it is not regulated by laws. So I wonder, this GHSA can be affected by the political issues. How I want to know how steep this agenda is. Is my question.
So you're talking about recent political, the corruption scandal in Korea. Since I'm no longer with government, I can talk freely about my political opinions. I don't think it's going to affect the global health security agenda, at least for Korean perspective. It's because although President Park announced that Korea is going to donate that amount of money, but it was more of a reorganizing a previous or current efforts providing that ODA. So it wasn't creating new money for that effort. It was just reorganizing and repackaging the ODA effort. So I should say the ODA effort is going to go on. We just need to make sure that regardless of the GHSA effort, we need to make sure that ODA covers the public health issues and surveillance and other priorities, workforce development and lab strengthening. We just need to make sure that multi-sectoral approach and a whole of society approach is realized during that implementation. I hope that answers.